So we've all heard about arthritis, but did you know that there are more than 100 types of arthritis? And rheumatoid arthritis can be one of the most painful. And here to help explain everything you need to know is Dr. Amir Amidi with Baptist Health Residency Clinic in North Little Rock. Doctor, thank you for being here.
Absolutely. Thank you for having me.
Yes, of course. So the first thing we're going to talk about is just what is arthritis and why are there so many different types?
Absolutely. So arthritis in basic terminology is any pain or joint swelling that you have anywhere in the body.
Okay.
Now, the causes of it, go ahead and pick. There's infections, trauma, injury, overusage, and even your body attacking itself sometimes. So just a combination sometimes, or even just one of those things could cause what we call arthritis.
Oh, wow. I didn't know that there were 100 different types. That's very interesting. So let's focus in specifically on rheumatoid arthritis. Can you explain exactly what that is?
Absolutely. Just starting off with arthritis in general, 1 in 4 adults are affected. And out of those, 50% of those are in our working population. Now, coming down to rheumatoid arthritis, this is a chronic condition that your body actually forms antibody that uses to attack viruses or bacteria, but instead it starts attacking our healthy tissues, specifically our joints usually. So because of that, it was just diagnosed, and you need to see your doctor, you get diagnosed, and we take it from there.
Okay.
That's what makes up rheumatoid arthritis.
So you kind of touched on it, but what causes it exactly? Can you kind of really nail that down for us?
The causes are unknown.
Okay.
Now, there are some risks that could increase your chances of having rheumatoid arthritis. First thing is going to start with age.
Okay.
The older the age, the more likely they could experience rheumatoid arthritis. Next thing is sex. Almost 2 to 3 times more female than male are affected. And smoking history, overuse injury, and family history. If the disorder has been running in the family, it's more likely to be in the subsequent generations.
So I wonder why women are more affected by it. Any medical reasoning behind that?
Just when it comes down to autoimmune disorders, unfortunately, based on most disorders, usually the female is more affected than the male. But, you know, in regards to rheumatoid arthritis, recent study shows like women who are breastfeeding can decrease their chances of developing rheumatoid arthritis.
Wow, well, that's interesting. And how is it diagnosed? How do you know that this is what I have? And then how do you treat it? We've got about 30 seconds.
If you have joint swelling in one or more than one joint, usually on both sides of your body, and within 6 months, I would say see your doctor. You need x-rays, lab work, and further evaluation to be diagnosed and be treated. We don't have a treatment option, but we can stop or slow the progression of the disease further to help individual have a better life.
Okay, well, that's good to know. At least we can kind of help in the ways that we can.
Absolutely.
All right, thank you so much. So Dr. Amidi, thanks for joining us this morning. You can contact Baptist Health by going to baptist-health.com or calling the Baptist Health line at 1-888-BAPTIST.